Hi, welcome back to Staying Healthy and Preventing COVID-19 Infection During the Current Pandemic. This is the video 23. We're going to discuss about the terminal events from COVID-19. In the previous video, we discussed that the attachment of COVID-19 to ACE2 receptors lead to a negative vicious cycle. This actually gets worse day by day, starting from about day 6 or day 7 of the illness. This includes a downregulation of the ACE2 concentration and unopposed activation of angiotensin II hormone. As there is insufficient ACE2 to cleave angiotensin II, the beneficial hormone angiotensin 1 to 7 will not produce. So everything happening in this stage is negative regulation and causing havoc in the internal body system. So how this renin-angiotensin system causing such a mess? The building up of angiotensin II causes not only inflammation but also massive release of synthesis and release of inflammatory cytokines, creating a cytokine storm. So this storm can, as we discussed previous videos, lead to large-scale leaking of fluid from the blood. In other words, it's increase the porosity of blood vessels, and this fluid will leak into soft tissues, including into the lung, causing pleural effusion and pneumonia. So consequent pulmonary edema make it the entire system dramatically worse. The vicious cycle then begin with the further release of angiotensin II to a much higher level, causing further cytokine to release in batches and causing really bad situation. Indeed, this is a death trap because there's no way of preventing it because the body has no ability to reverse that situation, especially in the absence of adequate amount of vitamin D and weak immune system. So these steps eventually lead to acute respiratory distress syndrome is usually the final common pathway of dying people with COVID-19. So with the development of pneumonia and the fluid in the lung, there's a large reduction of the ability of the lung to transfer oxygen into blood and the removal of carbon dioxide from the blood into the pulmonary air space in the lung. Because of the pulmonary edema and pneumonia, the air space in the lungs become less and less till it becomes incompatible with the life due to lack of oxygenation. When there is insufficient or no oxygen transfer occurs through the lung membrane into the blood, it results in the severe hypoxia or lack of oxygen into the in blood, including the brain, suffer from hypoxic and cell death. So this leads to the organ failure quickly and death of that particular person. So this excess angiotensin II is the one starts a spiral of death. Unopposed excess release of angiotensin II hormone causes a marked release of inflammatory cytokine, massive inflammation, vasoconstriction, and thereby pulmonary hypertension and pulmonary edema, and eventually hypoxia or lack of oxygen that further increases the angiotensin concentration to suprapharmacological levels. Again, this vicious cycle then causes worsening of the pulmonary edema, diffuse pneumonia, hypoxia, acute respiratory distress syndrome will get worse and lead to death. In the absence of reasonable or good immunity, there's no way an affected person can break this vicious cycle to reverse the process. Neither there are any effective medicine at this stage which can reverse the situation. No drugs, no nothing is available when it comes to this late stage of the disease with acute respiratory distress syndrome. So then let's also look at another key aspect of the disease in management of patient in the intensive care unit, which is ventilator-related death. When such person was put on positive assisted breathing, unlike in other cases of pneumonia and lung failure, positive pressure could further damage the existing fragile few lung cells, viable lung cells, and may even in fact expedite the death rather than helping. No matter how much pressure or oxygen trying to deliver into the lungs at that stage by the ventilator unit, when the oxygen cannot reach the functional lung cells, there won't be any meaningful oxygenation of the blood. So ventilation, assisted ventilation actually failing, in fact might expedite the death. Without the oxygen transfer from the inhaled air through the pulmonary alveolar system into the cells, into the blood, then life becomes unstable. The only way to survive at this stage is to put on the person into a cardiopulmonary bypass machine and artificially provide the blood oxygenated blood from the machine. However, such facilities are hard to find. At this stage, the rate of death from pulmonary cell from COVID-19 infection is much faster than the ability of the lung to regenerate new cells. So therefore, the number of functioning lung cells continue to decrease to a degree that the lungs will fail to oxygenate the blood. At this stage, death is inevitable. So brain function ceases due to hypoxia, followed by the rest of the body. That is one of the reasons that ventilator-related death rates are so high compared to any other diseases. But the use of PEP ventilation system could reduce the ventilator-related death because it's a different mechanism it is using. However, at this stage, the only way to people to survive is not by any medicine, no procedure, no by magic, but kickstart the own immune system. At least this is still possible, but every hour counts towards the failure of the process. So this can be achieved through a provision of vitamin D, or preferably is activated from calcitriol as an emulsion. This is a new technology, it's available now from very few places. This can be administered usually through the buccal mucosa or actually through the skin, what you call dermal administration. It rapidly gets absorbed, and administering as an alternatively, the activated vitamin D can be administered as an intravenous drug as a last resort. Of course, not at the last moment people can survive or save from the disease, but reasonably early stages, these steps can be invaluable. This particular vitamin D preparation, the emulsion and the nanoparticle deliveries, is capable of raising the blood 25-hydroxy D concentration within 2 to 3 hours instead of days to the oral route of its administration. If the kidneys are functioning and the circulation is not too compromised, then the kidneys start producing these active hormone again within few hours, and also from the other cells like macrophages and other cells which can produce intracellular calcitriol from the 25-hydroxy vitamin D. So this enabled to kickstart the immunity as a last resort, and some patients it could be a life-saving step. In the next video, I will address the issue: who is most vulnerable to contract COVID-19 has. Not everybody develop COVID-19, not everybody die from COVID-19. So what are the vulnerable factors? And we'll go through that in the next video.